Great. We'll get started. Good morning, everyone. Thank you so much, members of the media, for joining us again for our weekly briefing about COVID. We are hopeful that there soon won't be enough to talk about, that we won't need to have weekly briefings any longer. We'll see if that comes to pass. I'm Cassie Sauer. I'm the CEO of the Washington State Hospital Association, and I'll start with a few opening comments. First, I would note again that hospital capacity remains just fine. We have continue to see either stabilization or declines in COVID cases, and we've got plenty of room for folks who have COVID and for people who have other issues that they need care for. And so we know that people have put off healthcare needs out of fears that the hospitals were too overwhelmed, and that's not the case any longer. So continuing to share that message would be great. We want to be sure that we don't see negative health impacts from people not getting care that they need, preventive care, if they're starting to feel some chest pain or inability to walk or symptoms that could be cancer. We want to get them in as fast as possible. The second thing I would really want to highlight is in the governor's phase 3. I don't know if folks noticed this, that the ICU occupancy metric has turned into a statewide metric rather than a region or county-wide metric. And that really, as we talked to his office about this, is a reflection of hospitals' willingness to work together and how much transferring of patients, medications, staff, equipment, and knowledge has happened around the state, and a recognition that we have shown that we are not a state where we'll let individual hospitals become overwhelmed, that it really is a group all across the hospitals, an effort jointly to take care of COVID patients. And so we thought that was a great solution. It actually was one that the governor's office came up with. We didn't suggest it, but we really like it, that they're going to use this statewide metric. So that what it means is that until every ICU in the state is at 90% capacity, it won't change the phasing. And I think that really makes a lot of sense. The third thing that I wanted to point out is that the Johnson & Johnson vaccine is here. I said last week we did not think hospitals would be receiving it. We had a handful of hospitals that did, and I think it went very well. I want to continue to point out there was some early reporting that suggested that this vaccine might be less effective than other vaccines, and we don't believe that is true after going through all the data. The testing environment for this vaccine was much tougher than the Moderna and Pfizer testing environments. The disease was circulating at such an incredible, this is when basically the world was on fire with COVID. And they tested their vaccine in both South Africa and Brazil, which had huge amounts of disease and very serious variants circulating. So we stand firmly behind that the 3 vaccines are clinically equivalent, and that the best vaccine for you is the first vaccine you are offered. And I know that a lot of places are working to make sure that people know what vaccine they're going to be offered, but we've heard a lot of preference now, or I shouldn't say preference, there's a lot of interest in Johnson & Johnson. There's interest in all of them, obviously. Everybody would like not everyone, but many people would like a vaccine. And there's a lot of appeal for Johnson & Johnson because it's a single shot. You don't have to schedule a second appointment. And so I think we're excited about all 3 and happy to have them all in the field, and look forward to getting more Johnson & Johnson. We have a little hiatus in receiving the Johnson & Johnson vaccine, but hope that we'll get more, believe that we'll get more in about 2 or 3 weeks, and then are excited for that to be back out in the field. And then finally, we greeted with enthusiasm the president's direction last week that all adults should be eligible for a vaccine by May 1st. I think that timing seems great, and we're excited to be in a place where we are able to offer the vaccine widely to Washingtonians, and not having to work through the eligibility rules, but really just be able to say there's enough supply and there's enough capacity, and we're excited to welcome people in for vaccine. So those are my opening comments. I'm happy to take questions about any of those. So today we've got some great guests. We have Dr. Mark Johnson, who's an infectious disease physician at Confluence Health in Wenatchee. And Wenatchee has been a place, Confluence in particular, Wenatchee in general, is a place that was very hard hit by COVID, especially over the summertime with some agricultural outbreaks. And so I think we're really looking forward to hearing from Dr. Johnson about his experience there, what he's thinking about when he thinks about variants, future of COVID, and whether people's behavior should change now, which I think we all think the answer is no. So we want to keep emphasizing that message as well. Rene Raddilyer-Bomers, who is the Chief Quality Officer at Swedish, and She was the brains behind the Swedish CLU vaccine site. I got to go tour that site. It was super fun to tour it with Rene. It's a really, really cool place, and now has been very involved in the Lumen field mass vaccination site, which is also, like CLU was so impressive when we were there, and Lumen Field makes CLU look kind of tiny, and so it's a gigantic undertaking to get Lumen Field underway. But we're really excited about it for its size, its the HVAC system that is there, the space that people have to wait for their 15-minute wait, and the transit ease. And then finally, we have Darcy Jaffee, who is actually WSHA's Senior Vice President for Safety and Quality, but we invited Darcy today because she is a nurse and has been volunteering at a lot of vaccine clinics as a vaccinator. She has been photographed doing that in a couple of media publications, but she was one of the volunteers for the first shift at Lumen Field. So we thought it'd be interesting to hear, like, from the perspective of a volunteer, how does Lumen Field work, and what kind of volunteers are needed, and what kind of training do they get? Just so I think it'll be helpful for everyone to hear. All of the vaccine sites around the state, I should say, many are still looking for volunteers, and so we want to really promote that as we move into the future of COVID and to a much bigger vaccine supply. So with that, Dr. Johnson, I'd like to start with you to hear what's happening in Wenatchee. What was your experience so far, and when you think about the future of this disease, what's hopeful and what's worrying?
Thanks so much for having me. I really appreciate this. Of course, the pandemic's impacted all of us in various ways. As an infectious physician here in Wenatchee, I've taken care of over 500 hospitalized patients with severe and critical COVID-19 during the course of the pandemic. So I think we can all appreciate how important the vaccine rollout is. And so I wanted to give a couple updates about that. I wanted to talk about some of our current testing numbers here in the Wenatchee area and throughout North Central Washington. And then I want to talk a little bit about what we've been hearing about the viral variants and how that might impact vaccines. So here at Confluence Health in Wenatchee, we have a 179 bed hospital, and we have outlying clinics, and our catchment area and our outlying clinics are situated in Western Grant County, Chelan County, where I sit right now, Douglas County, and Okanogan County. And so far, Confluence Health, we've given 10,383 first doses of vaccines and 8,343 second doses of vaccine. So for a total of about 18,700 vaccines. I do know that as of the 2nd of February, more than 10% of all residents of Okanogan County in the northern part of North Central Washington had received at least one dose of vaccine. So the vaccine rollout is moving quite well. But as you mentioned, we're still, if we could have more vaccine, we'd take more vaccine. And I think we're all in that same boat. I think what's important to note, our most recent census data here in the Wenatchee Valley, which includes the metropolitan area of Wenatchee and East Wenatchee, it's about, our total population is about 30% Latinx, based on that current US Census data. But we also know that based on the current phase, that about 8% of our valley are Latinx ages 65 and up. So over the last 2 weeks at Confluence Health in particular, 14%, and then last week, 20% of all our vaccines were administered to Latinx population. So we've been trying to focus on vaccine equity in particular. Of course, the large vaccine testing or vaccine administration site here in Wenatchee that is being run primarily by through state assistance and public health. They have been vaccinating a large number of patients, sometimes 800 to 1,200 per day. And so that gives us the opportunity to really focus on vaccine equity at our site. So for instance, on Saturday, 400 individuals were vaccinated through our hospital system, and a large percentage of them were Latinx population. We've been focusing on having some vaccine clinic times that have a lot of Spanish-speaking staff and have culturally sensitive and language-appropriate vaccine educational information that we can provide to these folks. And I think that's critically important. And then our testing rate, we've certainly seen a decline. Currently, we have about a 5% positivity rate. So for last week, we had about 1,600 tests performed for COVID, and 87 were positive. So that's a decline from December, when we were at our worst, when we had, during the entire month of December, we were testing about 3,000 individuals per week, and we had almost a 15% positivity rate. And I should mention, in our hospital, we are seeing that the testing rate our positivity rate is still higher than I'd like it to be, of course, but we are seeing that our hospital census has shifted quite a bit. So as of this morning, we have 6 COVID patients in our hospital admitted with severe or critical COVID-19, one of which is in the ICU. When we were at our highest census in December in our hospital, we had 43 hospitalized patients with COVID-19, which of course in a 179 bed hospital represents a huge percentage of our hospitalized patients. So we've seen a significant improvement, and we would expect that. We've all expected that with this virus. We knew that during November to January would be some of the worst times of the pandemic for hospitalization rates, just because we know how these viruses are, that during the wintertime with cold, dry air, that the aerosols stay in the air for longer, and the infective dose that's required to infect somebody is a lot lower. So as we're heading into the spring, we would anticipate these numbers go down. And I think that's also a testament to masking. Some people have asked, do we know if masking works? And the answer to that is yes, it works. It's an important part of what we're doing. But continued masking and then this vaccine rollout, those two things are part and parcel to our success in a response to this pandemic. But it's hard to say how well masks exactly are working for the COVID-19 pandemic, because we don't have a historical control to compare it to. I can't tell you if this year is better than the last COVID-19 outbreak, because we didn't have one of these. And so if we were to compare it versus a historical control of another enveloped RNA respiratory virus, namely influenza, I think that's helpful. And there's a lot of data streams we can look at, but if we can compare similar data streams year to year, I think that's helpful. So the CDC runs something called the Flu Surveillance Net, Flu SurfNet for short, and they keep track of a typical standard reporting data stream from hospitals and from public health laboratories. And that does not tell the entire story of year-to-year flu cases, but it's a standard reliable testing stream. And so we know that as of the end of January of this year's flu cases were down significantly. So we know that this year, as of the end of January, there was 1,500 confirmed cases of influenza through this testing stream. And that is a decrease from about 190,000 during the flu cases from the flu year prior. And there was about 20,000 flu hospitalizations from last year's flu season. And as of the end of January, there was 149 flu hospitalizations in the United States. Not in Wenatchee, not in the state, but in the country, 149 flu hospitalizations. And why is that? Well, from year to year, we vaccinate against influenza, and that vaccine is nowhere near as effective as the COVID-19 vaccines, 40 to 50% effective, but it's an important part of what we do. And so this year, more than 150 million Americans got a flu vaccine. I think close to 190 million doses were delivered. And so pretty good uptake of the flu vaccine this year, but the difference is masking. And so there is a profound reduction in number of flu cases. And so the masking is providing a benefit. So until we see the number of COVID-19 cases drop significantly, there's not going to be, in my opinion, a big change in masking guidance. We are seeing a decrease in number of cases nationally of COVID-19. The last few weeks down to about 50 or 60,000 cases a day, still about 1,800 to 2,000 deaths per day. And that's still higher than we need it to be, but that is a profound improvement from where it was just 6 to 8 weeks ago. 4 to 6-fold decline in number of cases is a huge win. But what we eventually need to see is less than 5,000 cases of COVID-19 nationally per day. And we're at that point, we can start to feel a lot more comfortable. So there's lots of room for optimism with the vaccine rollout. And I think that's critically important. But we still have to see cases go down quite a bit before there's a huge change in how we interact in day-to-day life. But I should point out that I think we're all aware that on the 8th of March, the CDC put out new guidance about what fully vaccinated individuals can do. Fully vaccinated meaning it's at least 2 weeks since their final dose of the vaccine series, whether that's the 2-dose Pfizer or Moderna vaccine or the 1-dose Janssen or Johnson & Johnson vaccine. And that guidance is a initial glimmer of hope of what's going to happen. Now, these are initial guidance, and it tells us that if you are fully vaccinated, you could go over to a friend's house who's also fully vaccinated and feel reasonably comfortable to have a shared dinner unmasked in that instance. But there's a lot of nuances to that. And we're still saying in public spaces, you're still wearing a mask. In employment spaces, you're still wearing a mask. But if the case counts remain low and the vaccine coverage rates continue to go up, we're going to see those guidance continue to, that dial will continue to change a little bit. But we still have to see the cases come down a lot before things change. So no change in travel guidance. It's still not recommended to get an airplane for domestic travel, and definitely not recommended to get an airplane for international travel. And people ask, why are we seeing cases go down for COVID-19? Well, it's the reasons I said before, that we're moving out of the winter season, but also we know that we're seeing a benefit of vaccines. So 11.2% of Americans are now fully vaccinated against COVID-19, and that is huge progress. I think it's a little above 12% for Washington State in particular. And we also appreciate that more than 25 million Americans have had lab-confirmed COVID-19 disease. Serosurveillance data from November of 2020 suggested that probably might underestimate the burden of COVID-19 infections by maybe 3 or 4-fold. So if by that we estimate that probably 25% or so of Americans have been infected with COVID-19 and thereby have at least some transient period of immunity against reinfection, at least for 3 months or so. Plus that more than 10% of us now are fully vaccinated. Now we're kind of at the 35% mark. And that is important. That tells us why things are getting better with our case counts. If you look at another viral infection that has a similar R0 value, polio in particular, has an R0 value very similar to COVID-19. And so 50 years ago with the polio vaccine rollout, we know that once 35% of people were immune, we started to see a benefit. And so it's not an all or none phenomenon. It's not that once we hit a certain level, everything is better. It's that as we keep getting better with our vaccine rollout, the case counts are going to continue to go down as long as we continue to mask. I think those are critical things, but the variants are a concern. Am I concerned about the variants? Definitely. Am I concerned that the variants are demonstrating vaccine escape right now, meaning that the vaccine is not protective against limiting your risk of severe or critical COVID-19 and COVID-19 associated hospitalization? No, I'm not. Could that happen in the future? Yes, it could. If we need to see case counts go down quite a bit so that the virus has less of a chance to mutate and continue to potentially escape the vaccine. So if we do this vaccine rollout the right way, I think we'll be in good shape. Thanks for your time.
Thank you. That was great. Somebody should mute themselves. Thank you. That was terrific. Really good information. And I just have a question for you. You are one of the hospitals, there are a few hospitals in the state that did get close to reaching crisis standards over the summer, that you had so many patients, it was nearly overwhelming to the hospital. Can you describe the response from your fellow hospitals across the state to helping you out and making sure that didn't happen?
July and August were tough times. November through January were incredibly difficult. So I know that during July and August, we had a lot of help from hospitals in the region, that we could not take all the COVID patients that we were getting. We were being overwhelmed. Our census was quite high, and we had an incredibly dedicated team of professionals here in Wenatchee taking excellent care of these patients. But at the same time, we could not have done it without collaboration with other hospitals across the state. So usually I wasn't really aware of what was happening, because my job as an end user is to see the consults of the critically sick COVID patients as they come to me. So I wasn't intimately aware at the time of when somebody came to our hospital and had to get transferred somewhere else urgently just to provide them care because we were full. I do know it was happening, and I know it's happening enough that it gave us a fighting chance to keep our head above water. As I mentioned, during December, our census hovered at incredibly high levels. Changes in therapeutics, I think, helped us keep a lot of patients out of the ICU. So that's why in December, I think our capacity increased quite a bit. Even though we had more patients in the hospital in December, a higher percentage of them were on the step-down unit, receiving care there with temporizing measures that kept them from requiring mechanical ventilation. So we could not have done it without collaboration with other hospitals. That was an incredibly important part of our pandemic response. And it was clear to me that there was a wonderful concerted effort across the state. Thanks.
Thank you. And I just want to point out that Confluence, when they were most overwhelmed, many of their patients were agricultural workers, immigrants, and people of color. And these are the folks that in some other states have not been able to find a place to get transferred. And in this state, I think the response universally from other hospitals was, we'll take whatever patient you need us to take. We're not asking questions about their insurance, their status does not matter. And so we're really, it's a huge part of our equity work. And we're really proud that people were so incredibly responsive. Okay, Rene, let's hear about the gigantic effort at Lumen Field, which is super exciting for those of us in the Puget Sound area.
Thanks so much, Cassie, for having me. So my name is Rene Raddilyer-Bomers. I'm the Chief Quality Officer at Swedish. And it's just my pleasure to be here today to share a little bit more about the community vaccination site at Lumen Field Event Center. Well, I'm happy to announce we had our first day this past Saturday, March 13th, and it went off with flying colors, very smooth. We vaccinated close to 2160 of eligible King County residents, many of those individuals from groups that have been most affected by COVID-19, working closely with community partners to bring in those vulnerable populations. Seeing the first shot administered was really emotional for our team. Many of them had come from the Seattle University Clinic, our Swedish care teams, and other healthcare systems in the area. So not just Swedish, have been on the front lines working throughout this pandemic. We're so proud to be part of this vaccination effort for sure. The first shot and the first clinic is just the beginning. At full scale, you've probably heard some of the numbers, but when fully operational with all stations and all 4 shifts, and there are about 144 stations, we should be able to vaccinate close to 22,000 people a day, of course, doses permitting, which is exciting. And while we wait for those dose supplies to increase, the site is going to be operating about 2 to 3 days a week, and will vaccinate approximately 5,000 individuals per week. So at the Lumen Field Event Center, Swedish will provide the clinical support along with other resources and supplies. It's our responsibility to manage the vaccine, the clinical staff drawing up the doses, in addition to managing all the other clinical roles that are on site. This includes those administering the doses and those who are monitoring the patients in the observation area after they receive the vaccine. Eligible King County residents can sign up on the subscriber list and will be notified via email when appointments become available for clinics. And only King County residents are eligible because right now those doses are allocated to King County based on the population. But our hope is if supply exists in future months, the site could become a regional hub. And the subscriber link for those who aren't aware is at the seattle.gov/vaccination. We recommend that all individuals who meet the current eligibility phase get vaccinated when they can. And over the next few months, we urge everyone to continue wearing a mask, just like it was described, practicing physical distancing, washing your hands frequently. Those are all important efforts in reducing exposure and following the most updated CDC guidelines. Now, we can't do this without our volunteers, and hundreds of volunteers, both clinical and non-clinical, have contributed their valuable time and their energy. Numerous Swedish Health caregivers have volunteered many of their own personal hours of their time, which is really meaningful. So I just want to do a shout out and thank you for everyone who has contributed and done volunteerism to help roll out the vaccine distribution as safely and quickly as possible. Thanks, Cassie.
Thanks, Renee. It's super exciting.
Yeah.
And we're also rooting for you to get more supply as well as Confluence. Everybody wants more supply. Everyone's continuing to want more supply. All right, Darcy, we'd love to hear from you. You volunteered you volunteered at some mobile clinics and the Seattle U site and now at Lumen Field, and love to hear how, especially how the Lumen Field experience was as a volunteer, and maybe do some recruitment and promotion for people who might want to volunteer in the future.
Great. Well, thanks, Cassie. And as you said, it's just been awesome to have the opportunity to volunteer at the different venues. And one of the things I really have enjoyed, whether it was at the Seattle U campus, at the mobile clinics that we've done, that Swedish has done all over this county, or at Lumen Field on Saturday, is there is an atmosphere of excitement among the volunteers, among the people coming in to get vaccinated, and it's very joyful. And in this time, and in this last year, being in that environment, I remember the first time I went to the Seattle U campus clinic, it was honestly a little weird to be around so many people, having been working from home for so long, but again, just joyous and awesome. The Lumen Field, I had the opportunity to participate in the simulation a couple of weeks ago, which was fun. And as Cassie, as you said, when I walked into the Lumen Event Center, I was like, man, this is giant. And the thought of having it fully operational was a little mind-blowing. Saturday, when I went in to be a volunteer, so I've been a nurse vaccinator at about 10 different clinics now. It's very, very well thought out. There is where you check in as a volunteer to where you get your assignment. It's very efficient. We quickly vaccinated people that came in, and I asked a few of my brief patients how it was to get this. It was hard to get scheduled, and everybody said it was easy to get onto the website and to schedule. They were excited that when you schedule your first dose, you automatically get your second dose scheduled, so you don't have to worry about that. I vaccinated people, a few teachers, a lot of people over 65, some caregivers. There was quite an array of eligible people that I had the opportunity to chat with for a few minutes. And I have complete confidence that as the vaccine supply increases, that get to 22,000 a day is completely doable. Before I stop, though, I do want to give a shout out to Margot Baikonen, who's the chief of nursing at Swedish. She has been at all these clinics. I see her everywhere. I don't know if she sleeps at all, but her and her nurse educators have done an amazing job with the clinical volunteers, making sure everybody's comfortable with their assignments. And some of this, some of the volunteers had not given injections in a while. And so they did a great job of educating and making sure everybody was competent to do their job. And anybody coming to be vaccinated at this clinic can be extremely confident they're going to have a great experience and get vaccinated, because it's the way to make our whole community healthier. Thanks, Cassie.
Thanks, Darcy. Great. So glad you were able to do that on Saturday. Sounds just such an exciting development. Okay, I'm going to start going through questions. And as always, you can unmute yourself and ask a question or send it in through the chat. So there's a first question is, wondering our thoughts on vaccine equity now that eligibility will be opening up. Do we think it will negatively impact older populations who haven't been vaccinated yet, now that more people will be able to qualify for appointments and potentially, hang on, I gotta scroll back up. Potentially take away spots from more vulnerable populations. Do we see an equity issue out of this? So I'll respond and I'll ask everyone else to join in as well. We are excited for the phases to continue moving forward and to open up. I think we really want to get as many people vaccinated as possible, and there will continue to be an equity focus. And so some of the pieces, I think you'll continue to see mobile clinics that are going to high impact workplaces, potentially to agricultural employers in the Wenatchee area or to ethnic community centers in other areas. They're also, one of the strategies Department of Health is suggesting, which I think is a really interesting one, is to have days be designated as like phase catch-up days. So if you were eligible in a prior phase, or if you've been identified as a high-risk day, maybe that you would come on that day. But at this moment, there have been, I think, a lot of appointments available for people who are over 65. And we are hearing, and if you all in the media are hearing different things, but I think it's been a real shift in the last 10 days where it seems like people who are over 65 who want an appointment have been able to find an appointment. Would you all, Rene and Dr. Johnson, would you all agree with that?
I would agree. And then I would also like to state that the city's been doing a remarkable job in partnership with the governor's office and working with community-based organizations to also ensure, as we roll out the clinic at Lumen, specifically, that we're assisting in getting some priority slots for vulnerable populations. And so that's one addition to also the efforts on the mobile side. The mobile clinics are a great resource, and it's just not one solution, but having many of those modalities.
I agree. We have seen our open appointment slots over the last 10 days or so change quite a bit. Previously, there was no open appointments at all, either at Confluence Health in Wenatchee or in the large vaccine site that's supervised by the state and public health. And that just tells me that, as these spots open up, it means that people that wanted to get vaccinated right now have been vaccinated. I think it's important to continue to allow people that were in prior phases to get vaccinated. I know that's happening, but it just sounds, from our data, we're ready to move to the next phase. So let's keep moving, and let's keep moving through people to get everyone vaccinated as quick as we can. Thanks. And
we did support the governor's decision to move that. He had said the next phase was going to start, I think, March 22nd, if I'm remembering right, and then moved it up to March 17th this Wednesday. And we were supportive of that. We felt like that we were ready. Okay, another question. From our perspective, how will hospitals and health systems play a role in ensuring that a lot of older patients won't be left behind when we move ahead this week in eligibility? And then the second question, are most hospitals using their patient data to reach out to folks and have wait lists? I think, as we mentioned, we feel like there's been a lot of outreach to older residents and have been hearing that people have been able to get spots. And then to your second question, yes, we actually asked explicitly to the Department of Health for permission to use patient data to reach out to patients. And I think it's important to note that hospital patient is a lot bigger than people who regularly go to the hospital for care. A lot of people go to the ER at some point and they're a hospital patient, even if they've only been there once. So they might have seen a specialist. They might have gone to a hospital-owned urgent care once or twice. And so hospitals and community clinics that federally qualified health centers, for example, are really the two safety net providers. And so we see a lot of people who don't have insurance or who are immigrants or have different speak different languages and through the ER. And so that can be a really rich place to find populations that may be hard to reach who have a trusted relationship with the hospital. So the Department of Health said, yes, we could use our patient data to reach out and encouraged us to retain about at least 20% of slots accessible to the general public to book, but that we could consider filling slots with as much as 80% of folks who had a record, who were already on record with the hospital. It's also really efficient because you've already got the person's name, birth date, address. It's easy to put them into the WAYS system. You don't have to start a whole new record keeping process. So if you can get a vaccine in a place where you're already connected, it's going to go a lot faster. So that's another appeal to that. Rene or Dr. Johnson or Darcy, any other comments on that?
One thing I did want to mention is what we learned from the Seattle University experience was for our older population, accessibility or comfort with technology is definitely a challenge. And so what's been great is increasing the volume of support around telephone and customer service to be able to make appointments for folks via phone through the call center. That's also on the state website. So if folks are struggling with using the technology to book their appointment, they can also call and get one set up.
Anybody else comments on that?
Cassie, this is Darcy. I would say I really would underscore the, especially for our older population, the ability of the hospital or clinic to reach out to their established patients. It is, I can tell you my own experience with my mother-in-law and getting her appointment. We needed to do that for her and help her. And to have her own physician to be able to reach out was very helpful. So we're really happy the Department of Health has given us the green light to go out and contact our patients established or patients who have been with our hospitals in emergency or urgent settings.
Thank you. I did the same thing with my dad who has Parkinson's and dementia. He was much more comfortable getting his vaccine at a place that he had a connection to. He was nervous about a big, kind of a giant public site that he didn't know anybody at. Another question, we are hearing some confusion about phase 1B2, in particular, who will newly qualify among those with disabilities and comorbidities? How are hospitals communicating with patients about this phase? We are largely relying on the Department of Health for this communication. They really are in charge of the phases. I think we are hearing this confusion as well. I don't know, Rene or Dr. Johnson, if you all are doing particular things about this phase, but I think it's all across the country, like what qualifies you in this phase has been a challenge.
I agree that it is a bit confusing, and so I can appreciate that people are hearing that. I think here in Wenatchee, we've been so focused on the particular part of phase 1B tier 2 that involves certain workers in congregate settings, including agricultural workers, that we haven't focused as much on this one. I would clarify from the question that amongst that group, it says those age, if I'm saying this right, age 16 and up who are pregnant or have disability, who might put them at increased risk of complications from severe COVID-19 or increased risk of exposure. And so it doesn't actually, this particular tier doesn't actually mention comorbidities. It focuses specifically on disability. And I think that's important to note because it's my understanding the next group of those ages 50 and up with 2 or more comorbidities, I think tentatively that was supposed to be maybe the 12th of April. So the disability and comorbidity part of this question, I think those have to be separated. Thanks.
So maybe this is Evan Bush at the Seattle Times, and just following up on that question, I have seen some Department of Health documents that suggest that the qualification is disability and one comorbidity, and so I'm just wondering if that's clear to hospitals, or if it's clear to the folks who are actually providing vaccine, or if that's a misunderstanding on my part.
Rene, do you have an answer for this?
Yeah, we might be able to help.
Sure, Darcy.
You're right, Evan. It's a disability that would place you at high risk if you develop COVID. So it's a subtlety, right? What we're relying on, though, as Cassie said, is the phase finder tool the Department of Health uses, and that as someone goes through that, if it says that they're eligible, based on the direction we're getting from the Department of Health, that Washington is using an honor system. If someone comes forward with the phase finder eligibility, it's not for the hospitals to question that. We take that at face value as we've been directed by the Department of Health, but it is definitely confusing. we're all just doing the best we can to make sure that we, include, we've also been directed to be more inclusive than, than being picky about it. So this seems to be working probably more often than not.
Other questions?
Is there an expectation that at some point the importance of phases will decrease to the point where, obviously we're talking about May 1st, but I'm just wondering, if phases will be phased out, for lack of a better word, just as supply increases?
I don't expect it to happen before May 1st. I don't know if other folks do, but I think that it's going to be, what I understand is this national directive on May 1st. But I think the phases might move faster than what the governor outlined, as you're already seeing this week from the March 22nd to March 17th. I think they're doing a good job of gauging, really keeping their ear to the ground about, from the vaccine providers about what's the demand, what's the wait list, when are you starting to see appointments available, and then we wanted to move ahead. So I think that coming phases might be, a few days to a week earlier than they've been prior announced. Maybe that's just a guess, honestly. I don't have inside information about that, but I think I expect we'll still be in phasing until May 1st. That could change for sure, but that's my guess. Anybody have a different guess about that?
No, that's my impression. And I think that especially when we're looking at Lumen and the possibility of increased vaccinations becoming available, where it's no longer a supply issue, then the phases are going to become less important, though still critical, especially during these few next months, while we're still gaining supply availability for our population.
It may seem weird right now, since there is such a dearth of supply, or there has been a dearth of supply, and every time we open a phase, there's so much demand. But we are spending a lot of time thinking about vaccine hesitancy and how do we address that, and how do we, that's a big part of why we want to talk about Johnson & Johnson. We don't want people to think it's an inferior vaccine. We don't believe it is. We really want to talk about, and really, I think the CDC guidance that if you've got 2 fully vaccinated people, you can be in a house together. That's a really nice, that is a nice perk of being fully vaccinated. So really talking about what are the benefits of vaccination. That's, we are simultaneously dealing with lack of supply and really thinking about how do we make sure people are ready to get vaccine when it's available to them. I have another question. What percentage, or do we have an estimate of the number of hospitals that are using wait lists to call people in for vaccines? Are most of them doing that? I think at this moment, you can get an appointment. I don't think you have to be on a wait list. I think on Wednesday, that's going to change again when the next phase opens up and there's more people than there is supply. So it's been a kind of up and down using wait lists depending on how much supply there is compared to how many people are in the phase. I think my understanding was on the Lumen field sign up was a wait list, but I know in my neighborhood, there were people who signed up for the wait list and got an immediate response saying, sign up for your appointment. The wait list was about 30 seconds long before they got the sign up for your appointment.
The concept of a wait list is more of a notification, I would say, list, so that we can streamline ensuring that we reach out to folks versus having it to the generalized public, so that we are able to target folks who meet the eligibility requirements.
And Dr. Johnson, are you all using a wait list right now, or are people just able to make appointments?
Largely, we've been able to just make appointments over the last couple of weeks. Obviously, there's been a lot of demand, but appointments are filling up. But as I said, over the last 10 days or so, the number of appointment availability is increased because I think we're ready to move to the next phase. So as you said, that could change as we move into ongoing phases and a big group of people are newly eligible. Yep.
The phases go fast. I mean, I think that's also worth noting is that people be helpful to tell your audiences that if the folks who are in the next phase, sort of grocery store worker, for example, who might not be able to get an appointment this week, they should be able to get one the next week or the week after. Like, I don't think it's going to be, this is not months of waiting. This is, days to weeks of waiting potentially. Any other questions?
The state at one point talked about, this is Evan Bush again at the Seattle Times, about having a centralized IT infrastructure for scheduling appointments and aggregating all of the disparate individual systems together. Is that still a possibility? I know Microsoft and others were looking at that, working on that using AI, but I am curious if anyone knows if there's an update on that front.
I don't think we have an update on it. There, some people are using PrepMod now. There are appointments listed there, and then I think you all have probably seen the I can't remember who designed it. A Microsoft employee or former Microsoft employee who put together another listing of who's got appointments. I had to look at it over the weekend. It's pretty slick, actually, but I don't know about the formal state appointment system. Renee, do you know anything about it?
So we are using a specific program, software that does both registration and it feeds into Ways Entry, and it's what all of King County is utilizing at their clinics, their mobile clinics with the fire department in addition to Lumen. So at least we'll have that consistency there. But in regards to statewide approach, I haven't heard anything more in relation to that work, though I know that there's been significant interest from many parties to try and streamline that process. What we learned at Seattle U is we had to use two different platforms. We did direct Ways Entry, meaning put in the vaccination straight into the state site, and have a separate modality for registering folks. And what's great about Lumen, and it's making it much more efficient, is it's the same software. So you're not duplicating efforts by doing double entry or a paper format where we had folks filling out paper forms.
Renee, what is that software?
Signetic.
Can you say it again? It was a little bit.
Oh, sorry. Signetic.
Signetic, SIGNETIC.
NETIC. Mm-hmm.
Great.
And it's been working great. Yep.
And King County got that software going? Great.
Through the city of Seattle in partnership with them. Yep.
Great. All right. I think that's all the questions. So thank you all very much. We'll plan to see you again next week. We continue to ask you if this continues to feel useful or not. If it doesn't, please let us know. We're happy to keep doing it, but also if it seems like you're getting all this information someplace else, it won't hurt our feelings. Hope you have a great day. Thanks a lot for joining. Take care.